this is Dr. Casebolt with Forum Health Greenville, and this is part 2 of talking about cardiovascular risk and how we can decrease it. So we're going to talk about testing. What tests can we do? Unfortunately, many physicians are testing lipids and they kind of stop there. And their advice is pretty basic. If you have high cholesterol, you should get on a statin drug. It's actually not that simple. There are more things we can do than just putting everyone on a statin drug. So it is good to get lipids. What we're looking for, the optimal lipid panel would have a triglyceride level below 100, an HDL that's at least above 50, a total and LDL cholesterol that are below the cutoff line. So total cholesterol somewhere between 150 to 200 and an LDL ideally below 100. So those are considered ideal lipid numbers. In addition, there's a subset called the apolipoprotein A. Now this is a subset of lipids. It's way more inheritable, so it's more of a family risk factor. So if you have heart disease that runs in your family, likely they had a high apolipoprotein A. It's important to get that. I'm only aware of one strategy that I have found that can lower apolipoprotein A, and that is a unique supplement called amla, also known as the Indian gooseberry. That also helps with blood sugar regulation, so that actually kills two birds with one stone. Otherwise, that's a hard one to modify, but if you have a high one, you can at least try the amla powder. Other tests that you want are a fasting blood sugar, fasting insulin, and a hemoglobin A1C. All of these are looking at blood sugar dysregulation. Any of those by itself is not sufficient in order to make a call of whether or not you have blood sugar issues. You need all three of those in order to make a determination. If you have concerns or you're wondering about which foods might be affecting your blood sugar, you can also wear a continuous glucose monitor. These are small, usually people put them on the backside of their non-dominant arm. There's a little tiny filament which punctures the skin, but it doesn't hurt. It's so tiny it actually slips between the nerves and you can't feel it. There's a waterproof bandage that covers it, so you can wear it 24/7. They usually last for about 10 days. They send a Bluetooth message to your cell phone, your smartphone, and they give a blood sugar reading every 5 minutes. So it's super handy to tell which foods might be making your blood sugar go too high, and these foods could be different for different people. So wearing a CGM, there's now one that's over the counter. Instead of every 5 minutes, it is every 15 minutes. It is not suitable for diabetics because it does not have an alarm that goes too low, but it is one of the Dexcom brands. So you can look up Dexcom over the counter and you'll find that particular brand. So that's blood sugar, and you just want to make sure your values are in the normal range. Another test that we like to do is called LPPLA2. This is a unique test because you basically, if your numbers are high, it's really honing in on one part of your body, which is your oral health. So people don't realize that just like we have a microbiome in our gut, we have a microbiome in our mouth. And just like in our gut, it needs to be optimal. So we don't want a bunch of bad bacteria in the mouth because they are definitely linked to the development of heart disease. They can migrate throughout the rest of the body, create irritation and inflammation in your heart arteries. That attracts cholesterol, which then forms like a scab over this irritation. And then the scab, if it keeps building, it can form a blockage. So we definitely want to make sure that we have good oral health. So if we find that your LPPLA2 is high, we're going to give you some easy things to do to improve the health of the bacteria in your mouth. We also want to know what your CRP level is. This stands for C-reactive protein. So CRP is a protein made by the liver in response to inflammation. So if your CRP level is high, then we are going to help you take measures to get it lower. It can be simple things like weight loss. Sometimes there are some supplements that can help lower the CRP level, but it's an important test. Similarly, liver enzymes. So we want the liver enzymes also to be in the teens. So unfortunately, Quest and LabCorp, these mainstream labs, they allow liver enzymes to get up to about 40 before they flag them as being too high. You can have liver enzymes chronically in the 30s and still develop a fatty liver, which is a risk factor for heart disease. So we want liver enzymes to be in the teens. I've already mentioned in another video homocysteine, so I won't belabor the point, but keep in mind your homocysteine should be 7 or below. Higher homocysteine is associated not only with cardiovascular disease, but also hypertension. We also want the vitamin D to be in an optimal range, typically 50 to 80, so we want that one higher as well. Another thing we don't want to ignore is hormones. So we're all going to lose some of our hormones as we age. Women are going to have a steep drop off at menopause, whereas most men will also gradually decline. Their testosterone levels will decline. So what impact does this have on heart disease? Well, up until menopause, women have an advantage over men. We have less heart disease, and it's thought to be twofold. Number one, estrogen protects against heart disease in women. Number two, women have a monthly period, and losing a little bit of blood every month actually keeps our iron levels at a better level. So after menopause, women aren't losing that iron every month, and there's no more estrogen. And so within 10 years, women's risk of having a heart attack rapidly approaches that of men. So how to mitigate that risk is my strong belief that women do better on many different levels, including cardiovascular health, if they get on a bioidentical hormone protocol and remain on it for the rest of their lives. I am on that protocol and I will never get off my hormones, so don't even think about taking my hormones away from me, because I'm not having it. So men, it's been proposed that male testosterone hormone replacement is actually bad for a man's heart. When this is done correctly, that is not true. There's been studies showing that inflammation markers can go down. The main caveat, if men are doing hormone replacement therapy, is to make sure that the numbers are balanced and that the hemoglobin doesn't go too high. And if everything is done correctly, it does not increase risk of cardiovascular disease for men. I alluded to, but I haven't mentioned it yet, another test we need to do, and that is the ferritin level, which is iron. So iron is a unique mineral. It's a mineral that we need some of, but like Goldilocks porridge, we don't want too much, nor do we want too little. If you don't have enough iron, you're tired and anemic. If you have too much iron, you're asymptomatic. You don't notice anything, but you now have higher risk of not only heart disease, but also cancer. So if the ferritin level is too high, we take a look at your supplements, make sure you're not cooking in a cast iron pot, which is going to absorb some iron into the food. We want to make sure that you're donating blood perhaps on a regular basis, maybe quarterly. It kind of depends on what your level is. And some people need to decrease their consumption of heme iron, which is the iron found in meat. So there's no heme iron in plant foods, and heme iron is the one that gets overly absorbed in people that have a high iron. So that's kind of a summary of the things that we can do to help you reduce your cardiovascular risk so you don't become a statistic like perhaps somebody in your family. So we don't want you to keel over from a heart attack, because in a high percentage of cases, the very first sign that you have heart disease is sudden death, and it's too late to change your ways at that point. So if you're interested in reducing your cardiovascular risk factors, you need to come see us, and we can help you do that in a very effective way.
Hi, Dr. Saxena here, Chief Medical Officer at Form Health. Thanks for visiting our channel. Make sure to subscribe to get the latest insights and information on functional and integrative medicine.